Oh, welcome back.
Yeah, welcome back. Well, vein problems are a cosmetic concern for many women, but sometimes they can be more serious or even life-threatening.
Yeah, Dr. Deborah Mangione is with the Wisconsin Vein Center and MediSpa with more now. And that's the thing, really, is that vein problems, it's a wide range. It can be just cosmetic or it can be very serious.
That's exactly right. Depending on whether or not it's affecting some superficial veins or just veins in the skin, or veins that are deep underneath your muscles, and that can be a big difference.
What are some symptoms or things that people can look for when they're looking at their legs, they see these veins, oftentimes they're visible?
Right, very often you have varicose veins, and so that's frequently a concern that most people see, and it may be the thing that takes them to a doctor, they ask the doctor about them, but if they're not having symptoms, they may be just a cosmetic issue, and so that's what they have to understand. But when the veins aren't working, and this is what we see here, we see normally functioning little valves in the veins. The veins are returning the blood to the heart and lungs, so they're fighting gravity. They're going upstream with their blood flow. And so they have little one-way valves located every several inches up the vein. If the valves aren't working, then blood tends to pool in the legs, the veins become distended, high pressure builds up in the veins, and then we can see the bulging and elongation of veins as they're holding more blood than they're meant to hold.
Okay. The second diagram shows a normal vein versus a dilated vein.
That's correct.
What's the purpose of this?
Well, that's what I was just explaining, that as the blood pools in the vein because it can't really go upstream and stay upstream, it's happening, gravity is working against us, and so if the valves aren't working, then gravity's holding the blood in the legs. So that's why the legs are more affected than anything else. We're upright creatures. Our legs are the lowest point of...
Like on the inside. On the outside, they look kind of ugly sometimes.
They look kind of ugly.
They can be hard, they can be bulging, they can just look like a little bruise.
If they become inflamed, though, you can have blood clot, okay? And that can be just from an injury, it can be from something spontaneous, it can be from crossing your legs over a varicose vein. The blood's already going slower because the vein is very elongated and maybe zigzagging. And so if you do something that may cause a clot to form, they can get very inflamed, very tender, and hard to the touch or red and inflamed. The problem is, even with superficial veins, if you develop a phlebitis, if the valves aren't working, those blood clots can actually get into the deep system, which usually is protected from anything in the superficial system because of working valves. And if that can happen, then those valves can allow the the clot to get into the deep system and go to the heart and lungs like an embolus can from a deep vein if you have a deep vein clot.
The good news about this is that there are newer, minimally invasive procedures, and that so much of the care that you can do now is right in your office.
That's exactly right. It really is an exciting time for vein treatment because as opposed to what would go on 15 years ago, we now have wonderful treatments that are really state-of-the-art. The gold standard is to do these minimally invasive procedures where we're inserting a little laser or another type of heat fiber inside a vein to close it off from the inside through a needle puncture. You don't have to go and have a vein stripping. You don't have to have large incisions on the legs. You don't need a general anesthetic. It can all be done under local anesthesia in the office.
The word vein stripping just sounds painful.
And I'm glad. Talking to many patients, it was very painful.
Yes, I'm glad there's other options.
Yes.
Are you talking more about like terms like sclerotherapy and things like that, or is this even newer?
Well, sclerotherapy's been around for decades. This is newer. This has been around for about 12, 14 years, using a heat method to close off the vein. And there are even more things coming down the pike, even trying to reduce even the need for any type of local anesthesia. And so it is really an exciting time. And it's important because veins are now getting attention that they didn't get when I was in medical school or and even today with people in medical school. They're not learning about veins. Veins haven't been considered an important vessel in the body. And now we are recognizing that there are so many things that we can do differently and that we can perhaps learn more about the veins and how they function. So it's really, really great.
Speaking of medical school, you're a cardiothoracic surgeon.
That's right.
I know heart disease because it's the #1 killer of people in America, but in women also. You're supporting this Go Red for Women event with the American Heart Association.
That's right. I am a cardiothoracic surgeon by training. I've spoken about education of women to help them understand the risks of heart disease for many years. Again, it's something that was ignored in women, and women need to be their own advocates. They need to understand that they have risks for heart disease. It is the #1 killer, and that it may present differently in a woman than it does from a man. Women may not have the typical crushing chest pain and sweating that a man has if he's having a heart attack, or she may not even have symptoms when she's having the angina type things. It may be a discomfort in her left arm, in her hand. It could be a jaw discomfort. It could just be a little nausea after eating. There are so many different things that can indicate heart disease in a woman. But if it's a repetitive type of event, that could be something that makes you want to make sure you check it out with your doctor. But the big thing is this Go Red for Women event is all about education. We are one of the gold sponsors, so we're sponsoring the breakout session with Transform Diet and Wellness in Wisconsin Vein Center and MediSpa. And Dr. Susan Rieg's actually going to be the speaker at the breakout session, talking about how natural hormone restoration and getting control of your weight can really help reduce your risk for heart disease. So the event is next Friday at the Hilton, and tickets are still available. And that number is up there now to call for tickets to that event.
It's 414-227-1412. It's going on from 10:30 to 1:30. And again, Dr. Susan Rieg speaking at the breakout session as well. And here's how people can contact you. If they have unsightly veins or painful or itchy legs or heavy feelings in your legs, you can contact the Wisconsin Vein Center and MediSpa to learn more or for a consultation by calling them at 262-746-9088 or wimedispa.com is the website for more information too.
Thank you, and it's a great event next week, so hopefully people will come and have silent auction, win lots of different things, purses, and also sporting tickets.
That's
Lots
awesome.
of fun.
Thank you so much. We
Thank you.
appreciate your time.